That's right. As always, we are joined by Dr. Syed Hussain of Trinity Health of New England. And this morning, we're talking about the FDA has just approved the first vaccine that will protect newborns from RSV. Now, it's also known as respiratory syncytial virus. The vaccine is going to be given to moms during their pregnancy. And of course, that is going to be protecting the babies for the first 6 months of life.
Yeah, this is a great development. Erica, you may recall what we went through last year collectively
yes.
as a country. With so many infants either hospitalized or sick with RSV. We had a big RSV surge last year.
That was heartbreaking.
So, absolutely. So this is very, very
stories.
timely. And this will be given, like you said, to mothers who are late into their pregnancy and will confer immunity to infants up to 6 months of age. Now, remember, this is the most critical time period where babies are most vulnerable to getting sick from this virus.
And then at that point, would the babies be given another vaccine?
Yeah, there's an antibody that just got approved for babies. There's also Pfizer's working on additional trials looking at older infants. So more to come on this, but we now have 3 tools in our toolbox against this virus where we had none last year, same time. So we have a vaccine now for 60 and above age group. We have an antibody that I just mentioned, and now this new approval of this vaccine in babies.
And you would say definitely pregnant moms should definitely get this. There should not be any apprehension,
Absolutely,
right?
absolutely.
All right, let's talk about the variants. There are a few moving across the country. Talk a little bit more about how these are different and what people should know.
Yeah, great question. So there are 3 variants we're keeping a close eye on. 2 of them appear to be related to the XBB variant that we saw a winter surge last year. There is a variant, BA286, which has been detected in at least 4 countries so far, that has numerous mutations to the spike protein, and which is probably the most worrisome. What does this mean? It's too early to tell. We don't know yet whether this variant will be more contagious or cause more severe illness. So more studies and more data is necessary. But suffice to say, if you're elderly or if you're in a higher risk category from developing COVID-19, then it's not a bad idea to bring those masks back out as we see an uptick in cases nationwide.
And are the symptoms any different or longer, shorter with these variants?
So it appears it's the same constellation of symptoms, Erica, same flu-like symptoms with these 3 variants.
All right, let's talk about another thing. People are still outside, summer is still here for a little bit longer, and tick-borne diseases are still a huge issue. So let's talk about this Pathovirus infection. There's been one detected here in Connecticut.
Yeah, there have been a number of cases. Now, this can cause, in most people, it won't cause any symptoms or mild flu-like symptoms, but in some, it may cause some CNS manifestations, which include seizure, confusion, irritability, severe symptoms such as those. And, you know, folks just need to take common precautions because there is no vaccine and there is no treatment against this tick-borne illness.
Oh, wow.
No, there isn't. It's just supportive management. So what folks need to keep in mind is, avoid grassy or wooded areas.
Sure.
If you are hiking or outdoors, then make sure you use CDC-approved repellent, tick repellent. Make sure you take a shower, observe for ticks when you're back indoors. You know, common precautions go a long way.
Yeah, unfortunately, it seems like the symptoms aren't too different as far as something from like Powassan and COVID.
That's right, exactly.
So how are people really supposed to just...
Yeah, that's why it's important to know the history. So if you've been in an outdoor area where we have seen ticks, or, you should examine yourself after you come back indoors for any tick bites or ticks on your clothing. Those are clues.
And your pets as well.
Exactly.
Yeah. All right, Dr. Hussain, thanks so much.
Thank you. Thanks for having me.
Appreciate it. Always great to have you back here with us.
Likewise.